Well, good evening, everybody, and welcome to another edition of Ask the Doctor. Tonight we are going to learn how to improve bone health and osteoporosis through functional medicine. The man of the hour teaches, trains, and lectures doctors. He's taught well over 10,000 hours. He is an incredible family man, businessman, mentor, and he's here to teach us a multitude of things. Please put your questions in the chat. We'd be happy to answer them at the end. So without any further ado, the amazing Dr. Bob Rakowski.
Well, Carol, thank you always, and welcome and happy, beautiful evening all, and a special happy, beautiful day after Easter. If you celebrate Easter, I always like to start with a little picture and background. I've been in clinical practice now. It's my 31st year, and I have a lot of experience with the full range of patients, from elite professional athletes to people sent home to die. And I've also, as Carol said, taught seminars all over the world. And I even taught a full-day seminar on healthy aging. And a component of that would be maintaining bone mass and muscle mass. So a lot of people have heard the term osteopenia, osteoporosis, bone loss. And so if you're familiar with anatomy, this is actually the femur, the thigh bone, where it connects actually into the hip bone. And if you look at this very, very healthy bone, as it's labeled here, you see that there's, I'll call this a very healthy matrix that's actually mineralized and not too big of holes in there, but there are. Bone is not solid. It actually has a network of blood vessels and other things in it. And the osteoporosis, well, you see that these pores have become much, much, much bigger. And so the bone is thinner. It doesn't have the protein matrix. It doesn't have the mineralization, and therefore it's more likely to break. When we start looking at this challenge, this is in the Western world, although the rest of the world is starting to catch up. We actually have the worst statistics for osteoporosis and a lot of other challenges. A woman's lifetime risk of fracture related to bone thinning is 1 in 2. A man's is 1 in 4. Now that's after the age of 50. And so we're going to talk about ways that we can prevent that. They actually call blood pressure the silent killer. Well, osteoporosis might be as well, because often the bones are thinning for an extended period of time. People may not have any symptoms whatsoever. They might start having aches and pains. That could be a sign. They could have a loss of height over time. By then, their vertebrae are actually beginning to lose calcium, lose height, lose discs, stooped or bent posture, and then the extreme could be even a fracture. So when you start looking at this graphic, what are some of the things that we can do to prevent? Well, how about exercise? That's going to be critical. How about diet? And I'm going to tell you the big 4: diet, exercise, stress management are the big ones, and certainly avoiding toxins are a big part of it as well. So notice here they say avoid smoking, drinking, but we're going to share some other toxins that people can avoid as well. When I teach a seminar or provide a report of findings to patients, I let them know that patients want to know the answers to 4 questions. So number 1, what's causing the problem? Not what do we name it, but what's causing it? Number 2, can I help? I always answer this the same. I don't know, but I'll try. But I've got a pretty good track record of helping people regain bone density, muscle mass, and overall health. How long does it take to make a difference? Bodies respond to frequency, duration, intensity, quality, and time of the stimuli. Then there's a question of cost. Well, depends on how far in decline you are and how fast you want to get better. And if you're in a really bad state and want to get better fast, well, there's certainly going to be an investment of time, money, and effort into it. I always say there's 5 other questions I want to know the answer to. How complicated is the case? And not every case of osteopenia or osteoporosis is equally complicated. How strong and resilient is the patient? Certainly, we have a way of quantifying that, but if by the time you're breaking down your bone, you're on a fairly significant path of decline. Is there anything in the chemistry we need to address? Is there an unresolved trauma infection, or is there anything else? And all these can come into play in every incidence of osteoporosis. So for instance, when we start looking, what's the anything else? There are women that have gone through a breast cancer treatment. They go on hormone blockers, and then one of the side effects or bad effects of that is bone loss. And that can be a big problem. So, what do we do about that? That could be a significant question. I like this picture of aging. And you see this beautiful young girl, and then over time she ages. And you'll see this is DNA or the genetic material. And what I've said over time is that aging is progressive DNA damage, but it's also deterioration and loss of function. And let's face it, we're all going to age, but not all of us have to have osteoporosis or osteopenia. There's things that we can do to prevent that. This is a graph of typical changes in bone mass with time. And, somehow they assume this peak is going to be around 25. It might be 30. People will assume or acquire a peak mass of bone, and then they begin to decline. Now, you'll notice that women have a much more significant and more rapid decline than men. And by the way, they also have, generally speaking, a lower mass. So they're going to be a lot more at risk for osteoporosis and fracture. And the data clearly shows that. Now, when I would teach seminars on healthy aging, I would tell people that, when I do a report or I should say a history, an interview with patients, I'll ask them, when's the last time you felt good? And I'm pretty shocked that it's not uncommon for someone to tell me, the last time I really felt good was junior high school. I thought, oh my gosh, how can that be? We're here to have a lifetime of great health. But then you begin to realize that, the choices they made really accelerated their decline. So this graph shows a typical lifeline. People start feeling bad in their very young years. It accelerates after 30. And then the sad reality is they're nearly dead when they die. But notice people that take care of themselves, that are very, very proactive. 30 doesn't look very, very different than maybe how someone felt at a very young age. And then let's jump out to the mid 60s, and you see, someone in their mid 60s might feel like someone else who made lesser choices feels in their 30s. And I see that very, very commonly. But maybe the question is, what can we do about it if someone's on this big decline? Well, I've seen people make very dramatic changes. They can improve their bone density, their muscle mass, their organ reserve, their circulation. They can improve their blood sugar, their inflammatory process. And I always tell people, if you have a pulse, you have a prayer. But I'd rather start early when we start working with people. So the reason I want to show this line here, again, two different people, but if you start out with a higher rate of bone density and have a slower decline, you may live your entire life with absolutely no problem. But if you don't ever hit that good peak and you start declining faster, you could be in your 40s or 50s and really, really struggling. And we certainly don't want to do that. Now, when we start looking at bone density studies, they do different types of ways of looking at the skeleton. One is called DEXA. That stands for dual energy X-ray absorptiometry. Not my favorite way of looking at it, even though it is a gold standard, because I don't like radiating people. Radiation does induce DNA damage. But here's the thing that I like to tell people is that when they do a bone scan, they actually compare people to a young, fit, healthy, strong 30-year-old. So if you take a petite female over the age of 50 and try to compare her bones to a healthy 30-year-old, very, very often you're going to tell her that she has bone thinning or osteopenia or even osteoporosis. And here's what I'll tell you. In my practice, I don't ever recall in my 30 years seeing a petite female over the age of 50 that wasn't told that she had osteopenia or bone loss. And here's what I'm going to tell you. Everybody doesn't, especially the people that see me. Many of them are very proactive. They've been doing great things, but they're just comparing to a bad measure. You've heard me talk about the deadly quartet: stress, toxins, malnutrition, physical inactivity. These are going to take away years of our life and quality from life if you don't do them right, but they'll also deplete your skeletal system as well. So we'll start with stress. And what's very, very interesting is when people are under high stress, they release cortisol, which is in the category of glucocorticoid. And there's some technical things on this slide, but there's so many different ways that you show when you elevate your stress hormones, you're going to have bone loss. So osteoblasts are what are actually going to lay down new bone. Those are inhibited. Osteoclasts break down bone. Those are actually promoted. And you might ask, well, why in the world would that happen? Well, your body doesn't want to invest energy into making bone if you're fighting or fleeing for your life. And it might need some of the minerals, and it might need some calcium to alkalize and things like that. And remember, the stress response is supposed to be brief. You have a fight or flight mode, you exercise that, you get away, you survive, and things then go back to normal. But that's not how humans do it. A classic condition of excess stress hormones is called Cushing's disease, and that's often related to a pituitary tumor. And this is going to be bad for the entire body, but notice that osteoporosis is one of the manifestations. The heart goes bad, people become obese. It's just not something we wish on anybody. And then a different way of looking at it. When cortisol is high, growth hormone, which is repair and muscle and fat loss and things like that, declines. Sex steroids decline. Remember, you're either making stress hormones or sex hormones. And what do we see? People gain visceral adipose tissue. That means they get a big belly, they become progressively inflamed, and they will break down muscle and bone. And another significant part of this, when people are under stress, is women are going to rely on their adrenal precursor known as DHEA to make their sex steroids. And by the way, men as well will make 50% of their testosterone from DHEA after the age of 50. And if we make those effectively, it's good for our body, good for our brain, good for our bone, good for our muscle. And if we don't, all of those things will decline. One of my favorite interventions is the stress reset. I recommend melatonin, theanine, Ganoderma spores every waking hour. I often will do that from 7 to 10 days, but the most I've ever done is 21 days. I think a lot of people are believing that stress now is absolute highest in the world. I had a woman in this afternoon and she said, can I keep doing this? Well, if you keep doing it all the time, you tend to ignore constant stimuli, so it may be less effective. But I said, you can, as needed, take any one of these things any point in time. But after a period of time, we probably don't want to do it every waking hour, but something needed to be restructured in her life to really get away from the stress. When we start looking at our toxic world, when it comes to bone, I'm going to look specifically at heavy metals. In this quote, the modern skeleton has 500 to 1,000 times the lead of pre-industrialized humans. And you might ask, well, what in the world does that have to do with bone? A lot. So I went to PubMed.gov and did a search on heavy metals and osteoporosis, over 1,000 studies. And here's what it says: exposure to heavy metals and the risk of osteopenia or osteoporosis, and looking at many, many studies. And the conclusion is simple. They specifically called out lead and cadmium as being strongly related to osteoporosis. But I happen to think it's more than just that. That's just what that study just happened to look at. And so, if it is in our soil and in our air and in our food and in our water, how do we protect ourselves from these heavy metals? And the answer is we want to clear them from the body. And so the body makes something called metallothionine proteins. And these are the most powerful way to clear heavy metals from the body. By the way, if you're familiar with the term glutathione, this thione here is very much like the thione and glutathione, a very, very powerful detoxification molecule. But metallothionine proteins are those which are best at clearing the heavy metals. And by the way, they also need a lot of zinc to make these metallothionine proteins. We know now that these heavy metals function as metalloestrogens. And it's estimated that these are related to a significant increase in breast cancer, prostate cancer, hormone-related cancers. So it makes sense that we want to clear them from our system. Now, the good news about Ganoderma lucidum, and this is a fairly new study. Ganoderma, also known as reishi, increases metallothionine proteins by 800%. So they're very good at helping the body to clear heavy metals. And by the way, if we look at across the board, stress, it buffers stress, toxins, it clears toxins, including heavy metals. Malnutrition, it's considered nature's perfect nutrition. And then exercise, it gives the body more energy and more inflammatory control to promote healthy exercise. But when it comes to toxins and detox, I recommend an intense detox a couple times a year. By the way, if people want to try a water fast or a juice fast, they're not likely getting the nutrients that they need. So I'm a big fan of detoxification medical foods, where we dot the I's, cross the T's, and give people the nutrients that they need. And I recommend 2 of these a year. 7 to 10 days of intense detox with organic vegetables and support nutrients. And we want to support all of the detoxification pathways: the skin, the liver, the intestines, the kidneys, and the lungs. And by the way, Ganoderma is really good at that. When we look at malnutrition, very sad reality is that in the Western world, we are profoundly malnourished. And I found this to be a very, very sad picture. This woman, she was able to get out of her wheelchair, awesome for now, but drinking a sugary acid beverage and processed junk. And as these increase acid in the body, it results in depletion of the bone minerals. Malnutrition, terribly common just in our general population, but especially in hospitalized and in assisted living centers. So we really want to go the extra mile to take care of our seniors. Malnutrition, #1 cause of death on the planet in 2020. Every country on planet Earth now suffers from malnutrition. So we've depleted the soil, and we want to go the extra mile to nourish. I'm going to share a little bit about vitamin D, because vitamin D gets a fair amount of press, and it really should. And this chart shows that when vitamin D levels are higher, 50 and above, there's a very good reduction in a lot of different cancers. But it goes much beyond that. Every single cell of the body has a vitamin D receptor, and vitamin D is absolutely critical to bone health. I think I've talked through this, but this might be the first time I'm sharing this table on Ask the Doctor. So the labs say, well, we don't want your vitamin D less than 30, which is about Ricketts level, but we don't want it above 100. Now, when we look at this, we can see that in the animal model, this is NIH.gov, they could raise the blood levels to over 400 without causing toxic symptoms. So vitamin D is wonderfully, wonderfully safe. And by the way, vitamin D is great at preventing transplants. So also, by the way, Ganoderma is really good at preventing transplant rejection, I should say. And so the safe upper limit, 10,000 international units per day. And I'm a big fan of combining D3 and K2. When we're younger, we can make more vitamin D. So we get out and get good sunlight exposure. 20 minutes a day is sufficient. The skin starts the process. Then we've got the liver and kidneys that'll actually finish the process. While we're on diet, I really love the concept of alkalizing. I read this book years ago, Alkalize or Die. And since I like to put a positive spin on it, I say alkalize and thrive. And an alkaline diet is proven to enhance bone density and muscle mass and protect against chronic illness and prevent cancer and enhance toxin excretion. So wouldn't it make sense that we would focus on a more alkaline diet? But back to bones, someone had a very good, clever advertising campaign. They said, you know what? Tums is an antacid, therefore, why don't you take it because it has calcium, you can build your bone. There's a flaw to that. You actually need hydrochloric acid and stomach acid to absorb calcium. And without it, your absorption is terrible. But the bones are the strongest reserve of calcium. And as the body becomes progressively acid, the bones will demineralize to release the calcium to protect all of the other biologic processes. And if you lose too much bone, then you're going to get osteoporosis. So when we start looking at minerals in bone, we've got calcium, phosphorus, magnesium, potassium, zinc, copper. And by the way, there's a bunch of others in there as well. And there's also a protein matrix. So just taking calcium itself, is not likely going to be sufficient to build good bone. So I'm a big fan of my complete nutrition pyramid. A really good diet, superfoods, Ganoderma is the number one. Functional foods. When we start functional foods or medical foods, we have medical foods that can clear heavy metals, those that can modulate the inflammatory process, those that can buffer hormones, those that can alkalize, those that can detoxify. So all of those could have a place in preventing or reversing osteoporosis. Then we go with a good multivitamin, multimineral, omega-3s, probiotics, and a combination of D3, K2. And finally, exercise, which, by the way, should go with supplementation. Weight bearing is always better for bone density. And then, a couple different websites, exercises to build your bones. And this one specifically calls out women over 40. Why women over 40? They have the greatest need and they want to be weight bearing to do that. And by the way, high intensity is proven to be better at building bone. So with that said, that wraps up the references that I was going to share. But simple fact, losing bone just reflects a degradation of the entire body, which can be slowed down dramatically with really good, healthy lifestyle choices, including eat right, drink right, think right, move right, sleep right, poop right, talk right. So Carol, any questions in our chat?
Yes, we do. We're going to start with, what products would you recommend for menopause?
Well, let's start with the description of menopause that I like to share. So, and I'll tell the backstory behind it because stories stick. So I started teaching in Sweden in the mid 1990s. Beautiful country, beautiful people, love it. And the Swedish term for ovaries, the female reproductive part that holds the eggs, is actually egg stalkers. And, a little baby in utero has somewhere between 7 and 10 million eggs. There's an absolute ton of eggs in those little females. Then by the time the female's down to 37, there's, an estimated 25,000 eggs remaining. Then by the age of 52, there are no more eggs. So at that point, the egg stalkers will actually close shop. So, much earlier than that, the ovaries stop making the estrogens and progestins. And 50% at the age of 37 of the female's sex steroids are made from DHEA, which is made by the adrenals. So one of my favorite things is stress resets early and often, maybe a couple times a year, starting in mid 30s for females. So we keep those adrenals strong, not having excess corticosteroids and making the right amount of sex steroids. That's going to be a good start. We're going to want to alkalize. We're going to do comprehensive bone supplementation. There's a product I recommend called Bone Builder. It's complete bone matrix, including minerals and the protein matrix from New Zealand cattle. And it's tested for heavy metals, so it's not full of the heavy metals. So, the entire nutrition pyramid, stress reset, sex steroid balance, and comprehensive bone meal for bone building would be a good start. But keep in mind all the lifestyle. That's the supplementation component. Eat right, drink right, think right, move right, sleep right, poop right, talk right every day, and start before menopause.
Excellent. Lana asks, what is a good protein powder that they can buy to gain muscle?
Well, it's said that the highest biologic value proteins are meat, milk, and egg. And so those are going to have the essential amino acids. Those are going to be great at building muscle. And when we start looking at protein powders, there's a bunch on the market. I'm a big fan of whey protein. And I think one of the best they ever came up with was the OGX, which some places is in back order, some places not. You might be on back order in Canada, but the great news is Organo has found a way to get the whey that we need to ramp up our production, and they're going to do that. It's a slightly different formula because we're going to use the European formula because it'll fast track, because it's actually going to be processed in Canada. but those will be back in the US in June, probably a little later in the year in Canada. But I like whey protein, but ultimately you want a clean protein, one that you enjoy. And protein generally isn't the nutrient lacking when it comes to building muscle. It's probably lack of exercise, too much acid, too much inflammatory process, too many stress hormones. When I would lecture around the world, I would often tell people that it's hard to overtrain, but it's very easy to under-recover with all the stressors, with the blue lights, with the lack of sleep, other things like that. So, get a good protein powder, nourish your body, mind, and spirit, but, do everything that you can to maintain a good and healthy existence.
Perfect. Next question. What would you recommend someone do if they are addicted to white bread, white sugar, etc., and how helpful would the OG shakes and other products help someone who has osteoporosis, poor overall health?
Well, so we want to understand this process of addiction. And when I would teach addiction, and I'm gonna actually share screen again, and I'm gonna insert a new slide. So give me just a moment. And I'm going to play a video that explains the process of addiction. But ultimately, almost everybody's been addicted to something at some point in their life. That's just a human thing. What do we get addicted to? Things that we like. Are there things that we like probably too much? And the answer is sure, probably many, many, many things. And white flour, white sugar. I'm having a hard time finding this video that I'm looking for. Do I have it? Let's see.
For more pleasure. Okay. And leptin signal.
Oh, there we go. I think I'm here. So I was looking for a different video, but I've got one. So let me see if it is what I want it to be. Share screen. It's not leptin I'm looking for. I'm looking for dopamine. Yeah, that should be dopamine. All right, so give me a moment. Here we go.
The scientific name is the nucleus accumbens, and it is the site where dopamine works. Dopamine is a neurotransmitter, and it conveys the feeling of pleasure. And pleasure, for lack of a better word, is good, except that a lot of pleasure, as it turns out, is not. In the process of going for more pleasure, we have changed our dopamine system. And one of the keys to addiction is the idea that after stimulating that system chronically, again and again and again, and it takes 3 weeks to do this, what happens is that the receptors for the dopamine signal now downregulate. Now there are fewer of them.
We know that the brains of people with obesity do respond differently to food. In that reward center, when they see palatable food, some parts of the brain light up a lot, that wanting part. But the liking part, once they taste the food, it's blunted. It's not that they're getting more pleasure and reward, they're getting less. That's like living with an urge that you can't satisfy. And so people think that this hyper reward condition or this inability to experience the same level of reward from the same foods that other people are getting is causing people to overeat in order to get that dopamine that they're missing.
You have to eat more to get the same effect. And that phenomenon is called tolerance. And then when you pull the chemicals that cause the pleasure away, now there's no dopamine and fewer receptors. And that gives you symptoms of withdrawal. So tolerance and withdrawal are the hallmarks of addiction. We know that this occurs with nicotine. That's why we have tobacco addiction. We know this occurs with alcohol. We know this occurs with cocaine, morphine, cannabis. It occurs with every single drug of abuse. And it occurs with sugar too. And that's relatively new data that has come out in, say, the last 5 years, which shows that sugar specifically downregulates the same factors, the same receptors in that nucleus accumbens, in the reward center, as does all of these other addictive, abusive compounds.
Addiction's a strong word, but it might be a really helpful word to push us to recognize the power of certain food on the brain. There is some evidence that becoming obese does change and blunt that reward system. So we do know that overexposure to McDonald's can.
So part of what I wanted to show is there's an actual structural change in the brain when we become addicted. And so you suddenly, no matter how much you take, you can't get the satisfaction you're looking for. And that's what really sets up addiction, or it's a lot harder to get to. 94% of rats prefer processed sugar to cocaine. And probably humans are similar, would be my guess. And most people are addicted. So, how do you get people away from white flour, white sugar, and things they're addicted to for the 3 weeks to get their brain to remodel, as good as you possibly can? So if you start enhancing the brain chemistry of addiction, dopamine is that primary. Ganoderma is good for that. It can be quite helpful. St. John's wort might be helpful for that, to change that around a little bit. There's an herb called Gymnema sylvester that kind of blocks the taste sensation. If you get a tincture of that and you try to eat something sweet, you can't even really taste the sweetness of it. So it takes away that part of the joy. But people need a good 3-week break for that brain to reset. But, one of the things they've said is once an addict, always an addict. And so if you're predisposed to it, you have to find a way to stay away from it, maybe for your entire life. That might be a hard thing to swallow, but you're better off not feeding your addictions, that's for sure. So I hope that answers that. Not sure if it did or didn't.
Okay. Kat says, I've been told I have arthritis throughout my body and I also calcium deposits. What can be done with calcium buildup?
Well, calcium's a Band-Aid, and it's a Band-Aid on an inflammatory spot. And so you want to get rid of the inflammatory process, that's for sure. The combination of D3K2 prevents unnecessary calcification, but can bodies heal from that? It's kind of a slow process, but it can. If you make the area, balanced, healthy, moving gently, ideal circulation, not breaking down the tissue, getting good nutrients in for replenishment and rejuvenation, it can go away. Even bone spurs can go away. We've seen that happen over time, but it's just a matter of your body being inflamed for too long. So the anti-inflammatory diet, lifestyle, medical foods can make a difference. And whatever areas are calcified, I'm going to assume there's different joint areas. You want to move every joint, every range of motion, pain-free every day. And here's what happens. As you start moving pain-free, your body gives you more range of motion to move. And as you extend that range of motion, you can remodel in a healthier way.
Perfect. Devin asks, which OG products would be helpful for someone who has experienced chronic nerve damage?
Well, probably all of them. But, the question I want to get to is what's causing the nerve damage? Is it a structural compression that needs to be resolved? Is it a biochemical issue? Diabetes is horrific for the nerves. Chemotherapy can be horrific for the nerves. And so if it's a structural problem, we got to balance the structure. If it's a biochemical problem, we need to fix the biochemistry. If it's a toxicity problem, we need to resolve that. And so, Ganoderma, great for the nerves in many, many ways. So, I would recommend the one they do consistently. My favorite, my go-to when I really want people to get fast gain, I love the spores.
Perfect. Devin asks what the name of the video on food addiction is, if people wanted to follow up on that.
So that Dr. Lustig, is with the University of San Francisco. That was part of a documentary called The Skinny on Obesity. And I cut that section out for teaching purposes. So if you were to look up The Skinny on Obesity, that's where that came from.
Perfect. Thank you. Claudio, are you ready to go?
Of course, always ready. Have one in the queue. In regards to cats' calcium buildup, I heard from an older Greek gentleman at one time, apple cider vinegar diluted in water daily will actually help break down the calcium and get it out of the body.
Well, so certainly a first do no harm strategy. A lot of people like it, enhances digestion, good nutrition. Why not?
Okay. Do you have a question, Claudio?
Yes, I'll ask kind of the same question I asked today on the call, inversion table, benefits of an inversion table, actually.
Well, it's traction. So when someone hangs upside down, they're anti-gravity and they're going to traction out the joint spaces in the spine, and that has benefit. And, we look at yoga as one of the oldest documented systems of exercise, and many of their postures are inversion because lengthening the spine is important. In fact, I've trained with great yogis, yoga masters, and they'll tell you a long spine is a strong spine. And so you want to keep it long and strong. And I guess if it's strong, that would have a benefit in terms of osteoporosis, osteopenia, and function. But it's actually gravity and weight bearing that increases bone density. So, could it be part of a complete program? Sure. Should it be exclusively what we do? No, we should do some really good weight bearing stuff too.
Perfect. What are some healthy, balanced breakfast options?
Oh boy, now we've got this whole game that we want to play. And, as my thoughts on nutrition have evolved, and really the science, they used to say that breakfast was the most important meal. Don't skip it, do this, do that. Well, maybe the new data is everybody should skip breakfast. If you're trying to get a 16-hour fasting window, then you skip. But I was at a conference 30 years ago, and Dean Ornish had just written his book on reversing heart disease. And Dr. Ornish is really a sage of wisdom. He's a great medical doctor, very functionally minded. And he was saying everybody should be vegetarian. Well, that's not true. We're all omnivores, but there are some benefits to plants. And there was Phil Maffetone, who was at the time Triathlon Magazine Coach of the Year. And he wrote a book entitled Everyone's an Athlete. And he was big into heart rate training and everything else. And Ornish and Maffetone were on the same panel. And they asked, what should you eat for breakfast? And Maffetone said, I don't know, filet mignon, eggs. He was a big fan of meat. And by the way, the carnivore diet seems to be gaining traction as well. And Ornish looked like he wanted to get up and strangle him. It's like, what are you talking about? People need to eat asparagus for breakfast and, whatever. So what should you eat for breakfast? Well, when it's time to eat, you should eat something that nourishes your body, mind, and spirit, matches your genetics, your physiology, and moves you towards a greater state of health. And I've done everything I shouldn't say everything you can for breakfast, but I've played the games of breakfast. When I read the book Fit for Life, the only thing I'd eat before noon was fruit. And I did that for, I don't know, half a dozen years. And I got to tell you, it felt good. It felt good to just eat fruit. Very, very easy to digest. I'd probably eat 3 pounds of fruit sometime from the time I woke up till noon. And then I'd start eating other things and I would combine my foods properly. That was pretty important. And maybe the combining is the important thing, but I'll go with the statement that I read. I'll go 2. One I read, one I heard. What you eat is probably nowhere near as important as how much processing it's gone through. If a food is processed, it automatically is less valuable. And then there's a TED talk on intermittent fasting. And this woman said, what you eat is probably nowhere near as important as when you choose to eat it. So have an intermittent fasting window. But here's what I'm going to tell you. Everything counts. So as I listed, my original food wisdom was, if God made it, it's okay. If man made it, stay away. That was Jack LaLanne. Then Michael Pollan said, eat food, not too much, mostly plants. Then we started looking at calorie restriction, intermittent fasting, et cetera, et cetera. And now my guidelines for food is eat real food, eat clean food, eat not too much, not too often, every color, every day, in a way that honors your physiology, your genetics, and your body goals, mostly plants. And that's a mouthful, and that's a lot there. But Xavius or Devan, whoever asked that question, if God made it, it's okay. If man made it, stay away. Nothing processed. Try to honor the intermittent fasting window. And then there's a lot of options.
Okay. Neil asks, are gastrointestinal issues easily resolved?
Well, if you're a gastroenterologist, no. If you're a functional medicine specialist, usually, but not always. And so, we've done some Ask the Doctors on gut, and I tell people 5 basic questions. What are you eating? How's your digestion? And by the way, digestion starts in the mind. Remember, Pavlov proved that. You start salivating, you start chewing. You want to chew the food somewhere between 20 to 40 times. Then we've got hydrochloric acid. Then we've got bile secretions from the gallbladder. Then we've got different enzymes from the small intestines. Then we've got proteases, lipases, amylases from the pancreas. I just said a lot there, but digestion needs to be good. People shouldn't have a leaky gut. They need to have the right bugs in their gut, and they need to poop, in a timing that allows them to absorb nutrients and not absorb toxins and flush things out in a timely manner. So, we tend to do in functional medicine really, really well with gut challenges. And I've had a handful over the years of gastroenterologists that had gut problems that came in to see me because medicine wasn't fixing it. And then when I went through it, I would ask them, have you been taught any of this? And the answer is absolutely not. They've been taught to scope, they've been taught to drug, but they don't even really recommend diet changes. But all that's critical. So make good food choices, enhance the digestion, seal and heal the gut, put the right type of bugs in, and make sure that the pooping schedule is an 18 to 22 hour window from the time you swallow to the time it comes out your backside.
Okay. Claudio, any more?
I could muster some up, but no, I'm good for now.
Okay. Dr. Bob, I think we're clear.
All right.
Hang on. Janelle has a question.
Go for it, Janelle.
I know you've brought or have said about high blood pressure, but my husband has high blood pressure, and I was just wondering what he should do or take, or.
Well, we got to figure out the cause. We got to figure out the cause of the problem.
Okay.
And so here's what we know: about 90% of people that have high blood pressure are overweight, and it matters where that weight is. He's not overweight, so if he doesn't have a fatty liver, if he doesn't have a fatty kidney, and it doesn't take much fat to get there.
Okay.
And that's a very fascinating thing. Sometimes people lose 10 pounds and it makes a big difference. But nitric oxide is what dilates blood vessels. That was Nobel Prize winning information. You can make nitric oxide 2 different ways. You can make it from the amino acid arginine, and that's a harder way to do it, to actually build it up, or you could break it down from plant-based nitrates. And Ganoderma has that, and beetroot has that, and other things have that as well. But you want to manage the stress, you want to modulate the inflammatory process, you want to alkalize the system, you want to make sure that they don't have a fatty liver, they don't want to have a fatty kidney. You need to make sure that insulin signaling is ideal, because insulin causes sodium reabsorption and fluid with it that actually elevate the pressures. And there's other factors as well, but those are the big things where I'm starting. Ultimately, the first question is, what's causing the problem? We want to figure it out and then undo it if we can. But as I tell people about blood pressure, you've got a tube. So if this were my tube, my artery, it's a tube. And if I start thickening the wall of the tube, then basically it grows inward and it becomes smaller and the pressure increases. So if you don't address high blood pressure, it gets worse. And if it gets worse, it can kill you. And so we want to figure it out fast and keep it under control. And I'll have people come in and they have high blood pressure. And I'll tell them, we want to get this under control fast, or you run the risk of permanent damage. So I'm okay with, a short period of time doing blood pressure medication if necessary. But over the last month, I had two gentlemen, and they were probably 30, 40 pounds overweight. Both had a bigger belly than ideal. Put them on a carnivore diet, and both dropped their blood pressure dramatically in just 2 weeks. And if you were to look up YouTube, Jordan Peterson in carnivore, his daughter had severe rheumatoid arthritis. She did only carnivore and had a phenomenal health turnaround. I don't think it should be forever, but Jordan Peterson's been on carnivore for 4 years, and he says his health benefits have been off the charts amazing. And he only does red meat and salt. That's all he does. Red meat, salt, and water.
So would him, he's on a CPAP machine right now. And with that, they said prior to that, it could have made his blood pressure if you'd have got it on sooner, that would have helped.
Well, maybe. But keep in mind that people tend to only have apnea at night. And so what happens if you're not oxygenating, your body says, wait a minute, I've got to find a way to get oxygen to the tissue. So it might just start circulating the blood more and faster. And possibly some areas, our arteries are amazing. All this blood in my body is not everywhere at once. Certain blood vessels constrict, others relax, and they allow flow, and it shifts around all over the place. It's very fascinating that way. We are truly wonderfully made. But it's true that lack of oxygen during sleep could be something that could raise blood pressure, at least for the time that he was sleeping. And if he's done that for decades, that could have created damage, don't know. But CPAP, I mean, again, normally people lose just a little weight and maybe the need for a CPAP goes away. Number one cause of obstructive sleep apnea is a fat uvula. And, again, you didn't say he's overweight, but it doesn't take much. Some people are just going to put fat in the wrong place.
Okay.
Thank you, Dr. Bob.
You're welcome.
And the rest of them are super quiet.
All right. Well, then we will wrap it up for this beautiful evening. I like to end with 4 questions, so I will. We'll wrap up with this. First question, why? Why'd you take the time to be with us tonight? There's so many other things you could do. Second question is the answer to the first. Why not? Why not learn about something, a topic in general that if you master it, you can be profoundly healthy. And by the way, why do we do this part of this? Well, we're in the business of health, and through healthier products like Ganoderma infused coffee and tea and shakes and things like that. Third question, why not you? Someone's going to say, you know what, this makes sense. I'm going to make healthy strategies, and maybe I'm going to try some of that healthy coffee and tea. And the final question is, why not now? The longer you wait to act on information, the least likely you are to act on it. So if someone referred to this Zoom or this Facebook replay or wherever you see it, get back to them and say, I'd like to try some of that. And you know what? I'm betting you're going to like it and your body's going to love it. So good night, all. God bless. See you next week.
Thank you.
Thank you,
Safe
Dr. Bob.
travels and Godspeed.